coming in.
Excellent.
I'll put the title up so everybody knows that they're at the right webinar. Top 10 smoking cessation touch points for 2022.
Excellent.
Okay, so I think I'm going to get started. People will come in as the time goes on. And just got to get everything to work here. There we go. So, hi everybody, I'm Ruth Ackerman and I'm the Director of Professional Programs and Education at the Ontario Pharmacists Association. And I'm very pleased to be here tonight with good friend Jane Ling to talk about smoking cessation, one of the most important things you can do for your patients and help them in their smoking cessation journey, which we'll talk about how long that journey might be. Greetings from the Ontario Pharmacists Association. I would be amiss if I didn't tell you that it's membership renewal time. You got to get your PLIs and all the other membership benefits for 2022, and we're really excited. We've done a lot of advocacy this year. We've got a lot of wins for pharmacy, but those wins have not been wins without you, and the amount of work that pharmacists have done this year has been absolutely amazing. We know you're tired, you've come off still doing flu shots, and now we're talking about boosters. So keep going. It's a marathon, it's not a sprint. We're going to keep going, we'll make it. We got a little treat with the regulated pharmacy technicians this year with the new regulations to allow them to inject flu shots as well as COVID-19. So this is pretty exciting, and hopefully in the future we'll find a good place for all of our pharmacy techs in our stores. So our agenda tonight is we'll talk about updates on certain things, and then we'll talk about tips for you as you go into the season of New Year's resolution, and then we'll have some cases and we'll have a Q&A. Put your questions in the Q&A box, and if we have questions at halfway point at top 5 tips, we'll go through those questions. This is being recorded, so you will get a copy of the recording, and we'll send the slides later as well. So before I introduce Jane, I just want to thank Johnson & Johnson Consumer Health for their support to bring this webinar to you tonight. So Jane, some of you know Jane, maybe lots of you know Jane. She is a practicing primary care pharmacist working at the North Durham Family Health Team in Port Perry, leading the smoking cessation and chronic pain programs. She is an adjunct clinical assistant professor at the University of Waterloo, where she develops and teaches the smoking cessation curriculum for 2nd and 3rd year pharmacy students. Previously, she was a community pharmacist for 30 years with Lovell Drugs Prescription Pharmacy at Glazier Medical Center in Oshawa. Jane is the founding member and president of Pharmacists for Smoke-Free Canada, whose membership includes smoking cessation champion pharmacists from across Canada. Its mandate is to promote the role of the pharmacist in smoking cessation in the healthcare setting through professional development and advocacy. Jane speaks about pharmacist-led smoking cessation with healthcare providers, stakeholders, and industry, as well as many tobacco addiction conferences across Canada. She authors the online accredited Ontario Pharmacists Association Smoking Cessation training modules and has received the Heather Crow Smoke-Free Ontario Award from the Ontario Ministry of Health, as well as the Canadian Foundation of Pharmacy Wellspring Award. Take it away, Jane. We're going to talk now about the top updates, the changes.
Okay, thank you. Thank you, Ruth. Thanks for that lovely introduction. And Ruth and I know each other well because we graduated the same year. And we won't tell you what year that is though, right?
Yeah, no, no.
Okay. But it's really nice to have her beside my side. And we really work well together. And Ruth has a lot of experience with patients with smoking cessation as well. So I hope that she chimes in and gives her viewpoint, because there's a lot of different stories out there with patients. And I know that pharmacists appreciate hearing those stories. So, but anyway, today I want to first say that anything that I say today is my opinion. And I do a lot of smoking cessation. So a lot of it is based on my practice evidence and what I've experienced in my practice. And so we reached out to Johnson & Johnson to ask them what's new in NRT. And so they told us there was two new things. One was the Nicorette Smart Spray with a new app, as well as a Nicorette lozenge. And there is another product coming down the pipeline that I'll talk about a little bit as we go on here. So the first one that I want to talk about is the Nicorette Quick Mist Smart Track. So what is exciting about this, and you can see the picture on the left here, it's similar to the Nicorette spray that we've always had, but it has a white background and on the cardboard, and you can see that means that it has a Smart Track app. And this app is very exciting because every time that a smoker uses the spray, they tap it to their phone and they can track their use. So there's lots of different things within the app that will give them information about their use. And actually, it was developed by behavioral scientists and leaders in health technology. And so they created this app and they looked at what did these smokers want. And so they developed the app with this in mind. And so it helps them to prepare to quit, to reduce their cigarettes, to stay smoke-free. So they're building awareness and knowledge of their smoking behavior. They're providing confidence and motivation to quit. And it's equipping smokers with coping and relapse prevention skills. And the other thing is to note is something that's come out is it used to say that it would start to relieve cravings in 60 seconds, but now we can say that the information and the studies show us that it can actually help within 30 seconds. So it's the fastest kind of relief for nicotine that's out there. I know a lot of my patients, they take it, they put it in their purse or their pocket. They take it on planes. There's 150 sprays in each spray unit, so that's a lot of sprays. And so it's a very, very convenient thing to use. And the technology that they use in the tapping is similar to the contactless bank cards and the NFC technology. So, and you can see on the right-hand side the picture of what it looks like on your phone, and it even will help you keep track of goals, milestones, money saved even, which is, I find with patients, is a real motivator. Days smoke-free, and so patients forget, what it was last week and the week before that. So they can look at this and it really helps to motivate them to move forward. And so this combination of behavioral support along with pharmacotherapy. So behavioral support is you. So you as a healthcare provider can look at this app and see what your patient has, what they've accomplished. So it's kind of like the same with blood pressure monitors. Remember that we keep that information there, or your glucometer. We as a healthcare provider could then look at that and see what happened. What did the patient what did the patient do in the last month, in the past few weeks. So this is a tool for us as well in helping our patients. So it is new technology. It's very exciting. I mean, younger people definitely are going to gravitate towards it. But I find that nowadays, like even people, 45, 50, 60, they like technology as well. So it's something to look out for and something that's new and exciting. And then the other thing I wanted to talk about was the new Nicorette lozenge. So it's quite different from the Nicorette lozenge that you had before. The one before was like a little tic tac, but this one is bigger. And what's exciting about it, it has a dual flavor layer. So the flavor actually lasts longer. And for anyone ordering, it does have a new NPN number. And the button on the unit to get the lozenge out is bigger. So it's much easier to use as well. And so there's two flavors, the fresh fruit and a mint flavor. In the spray, there is mint and cherry. I think there was also, they were talking about a third option that they were thinking of bringing out as well. But this lozenge launched in May of 2021. So look for that as well. You'll still see probably the old one on the shelves until it sells out, and then the new one will come in. And there's some exciting new tools that Pharmacists for a Smoke-Free Canada, along with OPA, developed. And so we updated our Canadian pharmacist smoking cessation pharmacotherapy algorithm. So it has, on the bottom, you'll see that it says updated 2021. We developed an initial tool, a follow-up tool, and a patient quit tool. We just had a lot of people giving us input about some of the things they would like to see in those. And we actually created a YouTube video of walking you through these algorithms. And I'll show them to you now. I mean, it's hard to, whoops, sorry. I thought they were there, just a sec. There, yes, here they are. So this is the algorithm tool. So you can, you're familiar with that. You can see the dosing and the treatments and the 3 A's, the ask, advise, and act. But what's really nice about it is it's a one-page, double-sided. A lot of times, if you can, I know for me, when I started out anyway, I laminated these pages and just had them handy beside me, beside my computer. And there's the initial assessment tool, there's a follow-up tool, there's a My Quit plan that you can give to your patient. And the other thing I wanted to let you know was that drug interactions, we've also created a new drug interaction chart with tobacco smoke. So Ron Pohar is our VP for Alberta, for Pharmacists for Smoke-Free Canada. So he worked on this. There was one that was available in the US, but we wanted a Canadian one, and we wanted one for our Canadian pharmacists. And he is very good at combing through all the information and all the data. So this is very helpful. It's currently available in English on our website. The link is there. And it's coming in French soon, so stay tuned. But all of these things are available on the Pharmacists for a Smoke-Free Canada website, as well as a lot of the tools are in the Ontario Pharmacists Association online modules. So I talk about them in the modules with the Ontario Pharmacists Association. So feel free to go there and check them out as well. So I'll go back to the one that was coming down the pipeline, and that was Cytosine. So Cytosine or Cytosine is something that is very similar to Varenicline. It is a plant alkaloid. And it is something that they've used in Europe for many years. But what's exciting about this new studies and new research, new product that they're coming down the pipes with, in the past, it was 1.5 milligrams, and it was used in a very complicated dosing regimen over 25 days. Well, this, they hope to have it at 3 milligram and give it 3 times a day. So it's a lot easier to dose. The dosing schedule of the other one was very, very complicated. So, you know, just stay tuned for that one coming down the pipe. It is exciting. I think that something new and something different might be coming down our pipe. I know we've all been having a hard time getting the Cytosine or Crave product that actually a pharmacist brought into Canada, the patent into Canada. But anyway, stay tuned for that. And so here, the next one we can talk about, Ruth, thank you, is new in reimbursement for NIHB. And what's exciting about this is I want to tell you that in the Atlantic provinces, they're doing a pilot where not only are patients going to be reimbursed for, which they already are across Canada, for the patches, lots of coverage for this group. You can see 168 tabs of Varenicline, 180 tablets of Bupropion, 252 patches, 945 pieces of gum, lozenges, or inhaler. But the exciting thing is that the pilot is reimbursing pharmacists for doing their counseling. And if this goes well, they are very hopeful that it's going to go right across Canada. So you can see here that our reimbursement for counseling is more than ODB. It's $250. So stay tuned for that. It is something that even with patients that I've met with, I can see this one lady sitting in front of me. She didn't realize that her NIHB would cover any smoking cessation products. And it does. It has a lot of coverage for that. So, so keep that in mind when you're counseling with your patients. And COVID-19, how could we get out without talking about COVID-19, even though a lot of us are tired about talking about it. But I wanted to talk about the latest evidence on smoking with COVID-19. And there have been some recent studies that I've put the links here on the slide. But everything is showing that smoking increases the chance of adverse health outcomes for COVID-19 patients. We're getting more and more data on this. And that it shows that these patients are going to be more likely to be admitted to intensive care requiring mechanical ventilation and are more likely to die. I mean, I think we all felt that, but when the initial studies started to come out, they were saying, well, could nicotine be a protectant? But in actual fact, when they teased out all the information and they took away a lot of the bias, and in fact, a lot of in the initial times of COVID, everything was just so hectic. They weren't collecting. I don't know if you've ever been to a hospital when it's been very hectic, but they missed collecting whether or not you were a smoker. So now that we're more active about doing that, this information you can see from Health Canada, from the WHO, they're all indicating that this is going to put you at more risk if you're smoking. And then the other component to that was, well, it's COVID-19. I'm so stressful. How can I quit? I'm just so stressed about all of this. But what this study has found through the BMJ is that quitting smoking actually lowers one's overall stress after about 1 to 3 weeks, with effects similar to an antidepressant. So I often tell my patients that you know, it is tough to quit, but on the other side, you're going to feel far better and you're going to be much healthier. And so I let them know that I'm going to be with them. I'm going to be side by side with them. I'm going to help them. And if they have any sort of mood problems or withdrawal symptoms, that we're going to work together to manage that. Okay, so vaping developments. There's been some new things happening in vaping. One is in Canada, the e-juice strength has changed, and I'll show you the slide about that. And also that we've developed some lower risk nicotine use guidelines and knowledge tools. So this one here, the Canadian nicotine concentration regulations have changed. They were at 66 milligrams per mil of nicotine for the e-juice, but now they've been lowered to 20 milligrams per mil. And this was done on July 8th, July 23rd, 2021. And this actually mirrors the UK regulations for nicotine concentration. In fact, the UK started many years ago, and it was always 20 milligrams per mil. In Canada, ours was high, very, very high, 66 milligrams per mil. So you can understand why parents were very upset, because for youth vaping, that amount of nicotine is huge. And I have to say, though, that for some of my patients who are smoking 3 packs a day, you know, I'm going to need that high of a nicotine dose in order to help them and prevent withdrawal. However, we will work with it. Perhaps there is some indications that maybe a higher nicotine juice will only be available in pharmacies. This is something that we're talking about in different committees and whatnot, but we'll see how that goes. But I wanted to update you with that. And I also wanted to update you that working with CAMH and Health Canada and a number of other organizations, including Pharmacists for Smoke-Free Canada. So Ron and myself actually sat on this development committee along with many other experts across Canada to develop some lower risk nicotine use guidelines. And the thought here is that the premise is tobacco harm reduction. And so you can see over to the right there in the middle with e-cigarettes and cessation that we looked at, that e-cigarettes with nicotine may be an effective cessation aid for people who use combustible tobacco. And this isn't something that, of course, that you're going to recommend first line or anything like that. You've got a lot of good products out there. You've got your behavioral counseling. But if you're working with someone that has tried everything at the maximum dose and has severe health problems, they've tried everything, should we be looking at possibly tobacco harm reduction? And so this is how to help people lower their risk. And we're just exploring that. We're trying to help pharmacists to provide some knowledge tools. So we developed some knowledge tools as well that you can hand out to your patients on e-cigarettes and what lower risk nicotine use guidelines are, and when should they be considering something like this. And in pregnancy as well, we talk about the water pipes, things like that. And this handout for your patients is very helpful as well, because it talks about, it gives some ideas for patients. Where are cigarettes? I mean, the most harmful thing is combustion. That's the highest risk. And then we're not saying that these are risk-free in any way. They still have risks. The best thing to do, of course, would be to be smoke-free and vape-free. But this is just something that's something new, something that we have now for patients to share with patients. Okay, so Ruth, I just wondered if there was anything in the Q&A or the chat that anybody wanted me to talk about before we get into the top 5 tips.
Yes, and you'll have to pardon me for my pronunciation of these things.
Oh,
So
that's okay.
is the
Cited,
Cytosine available
yes.
without a prescription? And is it ordered online like the Cytosine was?
Okay, so first of all, this product is not available. It is only in studies. It's in phase 2 study, so it is not available. You know, whether it does come to market, I mean, you as a pharmacist knows that we've seen many products that are in phase 1, phase 2 trials before they actually come to market. So no, it is not available. Unfortunately, the Cytosine, which is the Crave product, a lot of pharmacists have expressed, the Cytosine have expressed that they aren't able to get it. So I'm thinking that some of these companies are figuring out a way of maybe possibly making this in a different manufacturing plant at a different dose, so that it would become available for patients. So I certainly find when my patients want a natural product, because this comes from the tropical rain plant, I think golden rain plant, sorry, I think it is golden rain plant. That's something that they'd like to consider or more palpable for them. Okay, did I get all of those? Did I get that, Ruth? Am I okay there, or is there something else?
You're okay. Let's see.
Oh, yeah.
Here we
My
go. Oh, there they
Here we
go.
Okay, my patient insists his vape juice is 20 milligrams, not 20 per 30 mil, not 20 milligram per mil. So that kind of thing that you're asking there, Cheryl, is something that we as pharmacists for a Smoke-Free Canada hope to do, to develop the dosing guidelines for pharmacists as far as the nicotine juice goes, whether it's 20 milligram per mil or 20 milligram per 30 mil, those kinds of things, so that we want to have a calculator available for pharmacists so they can sort these things out. We have applied for a SUAP grant to be able to do this, so that we will have the pharmacist tools to be more accurate with this. So I mean, there's so many, there's 150,000 different flavors of in e-juice. That in its own, I've been to vape conferences. I've tried to understand it because my patients use it. So I feel as if I need to be credible in the space, but I would like a pharmacy tool for that. So Cheryl, we hope to have that for you, that'll make that clearer for you. Are there clinical guidelines to help vapors stop or reduce via NRT? So there aren't any official guidelines, but pharmacist's letter, December 2019, did develop something based on the fact that if a pod had this much nicotine in it, or if this e-juice had this much nicotine in it, this would translate to this amount of NRT. So again, we hope to have those tools and guidelines for you. That pharmacist letter, though, is currently the only one that's available. It's just it's not a guideline. It's just an article really about it. And but certainly have a look at it if you get a chance. It does give you some guidance, some practical, common sense guidance with that. Okay, now customer loyalty. Yay! So today
We have a special guest.
we do. We have a special guest. So Irina, oh, there she is. Hi, Irina.
Hi, Irina.
Hi. So Irina and I, we really connected, I'd say about a year ago when we were doing something with CAPSI together. And Irina shared with me that as a pharmacy student, we all know as a pharmacy student, it can be quite stressful. and that she was quitting smoking, that she had been smoking and she was quitting. And I was just so proud of her for sharing that with me, because personal stories just really resonate with people. So Irina and I worked on a few things together, and we did a video together. It's actually on Pharmacists for a Smoke-Free Canada. And she talks about her journey in her interaction with healthcare providers. And I think we can really learn a lot from her and her journey. So Irina, would you mind sharing a little bit about that?
Thank you, Jane, for such wonderful introduction. Yes, I would love to share a little bit about my story. I will give everyone a little bit of context as well. I'm a third-year pharmacy student right now at University of Waterloo. Prior to that, I was a heavy smoker for 15 years. So I grew up in Europe, and that was very common for everyone to smoke. So I kind of got into it. And over the many, many years, I've tried quitting a lot of different ways, more times that I have fingers and toes altogether, I would say. But there's very few quitting attempts that I had that really stood out to me that I wanted to share about. So I was having some problems with chest pain and stress. So I went to the doctor, and the doctor recommended that when I was at the appointment, that I go to the pharmacy and pick up one of the boxes of some nicotine. And if that doesn't work, to come back for something different. So that was my very brief interaction. So then when I went into the pharmacy, I was just, I was looking at the products, and I was hoping to speak to a pharmacist. This was before I was in pharmacy school, so I wasn't quite aware of what the role of pharmacists there in smoking cessation at the time. But when I went in and asked a question, I was just pointed to where's the aisle where that was. And then nobody cared to talk to me or ask me. And it felt quite disappointing. I remember feeling really sad because I felt very disappointed speaking with the doctor and just getting a very brief, go find a box on a shelf and go try it. No support at all. I went to the pharmacy, also no support at all. And then shortly after, I started working in sales at Shoppers Drug Mart. I was a manager of the department in cosmetics. So I got to learn so much about customer loyalty then. That's when I realized like how important it is to build relationships with patients. And all the customers that would come to me when I would organize sunscreen events and give them advice and follow up with them all the time. With the products that they bought, the samples that I gave them, it built so much business for my department, and it helped so much to build these trustworthy relationships. Because once a customer comes to you and you connect with them, they start to trust you, and every issue they'll have for years and years, from what I've learned, that will only come to you and that will remember you. And so it made me think, oh my goodness, if only pharmacists were like that with smoking cessation. If my interaction coming into that pharmacy it was a pharmacy that I always go to, the same community pharmacy I've been for years, and no one talked to me about, hey, what, spend 5 minutes with me and ask me how much I smoke, how I can help. And I had no idea that you can layer patches. Now I do. But before, I had no idea that it can be so personable. The NRT can be so personalized to each person. And so I feel like building that customer loyalty can go a really long way in terms of helping the patient actually succeed with a quit attempt and actually bringing in lots of business to the pharmacy. And I'm currently doing my co-op at the Grand River Hospital Cancer Center. So I do lots of smoking cessation, not from the community aspect. I just talk to patients and sell them the idea of quitting smoking. So I use my sales experience, the whole sales cycle with closing the sale, how to approach, doing the pitch. I've been practicing lots of that. And I find that one of the best conversation starters with patients is to, just don't tell them, hey, you want to quit. You say, how do you feel about reducing with and setting a quit date? What are your thoughts? It's all about asking that patient about feelings and thoughts and opinions, and not a very scary word, quit, like all or nothing. You know, it's a very fragile relationship that patients have with smoking. It can be very emotional, so I find that that's very important. But building that loyalty and follow-up is one of the best things you can do for your patient. And I think Jane has a really good slide with a how
Yes,
it adds up.
yes, I do. I do. We have that, don't we? Let's see. There it is. Ta-da!
There
Yes.
it is. That's the slide. That's the power of loyalty.
That's right. And Irina, you expressed that so well, though. I mean, you think of one person, you know, is really $50,000 client, because that patient can easily buy $100 worth a month of medication over 12 months. That's 1,200. So times 2 for miscellaneous products bought, so that's 2,400. 10 years, that's 24,000. And if they bring in one person because they really value you, now you're up to 48,000. So you have to, you know, that small investment in time and personal touch is just so important and translates into the $50,000 client. So I mean, I was just so impressed on how you took your business skills and applied it to your, you know, your pharmacy skills, your pharmacist skills, and the two combined. I mean, that's what a pharmacist is all about. I mean, we're healthcare providers in a retail setting. So, I mean, it's just win-win. And I really, really appreciate you bringing forward that thought to us and how important that is. And I want to congratulate you as well, because quitting smoking is one of the hardest things people will ever do. And I think you mentioned you're at 453 days smoke-free now.
Yes, let me double check that. I have a health app that tracks how much money I save every single day.
Awesome.
It's
Yes.
466 days today. So
466 days. That's awesome. And how much money did you save?
I saved $8,690.61.
Wow, that's awesome.
That's
awesome.
the tuition of a semester worth of pharmacy school.
Yeah, that's
pretty
tuition there.
So it made me feel good.
And
That's
if I
great.
remember
Congratulations.
isn't that amazing? That's just so wonderful. And if
Thank
I
you.
remember correctly, you used patch. What did you like the best? Because I know we were trying different things, but
yes, thank you. Thank you so much for your warm congratulations. I still can't believe it. Feels so good, because now I can relate with all my patients. When I talk to them at the cancer center, a lot of people actually, even having cancer diagnosis, it's really tough to get them to quit, because that is a big stressor. So lots of lessons learned.
right.
This time around, after 500 attempts I had, the nicotine patches worked for me the best, but I personalized them. So I layered multiple patches until I felt like my body was telling me, okay, that's about enough, we're good. And then every time I stepped down, instead of following just the generic product monograph manufacturer recommendation, I just listened to my body. Whenever I started to get nauseous or dizzy, I knew my body's ready to step it down. So I think it was I was on a patch for 8 months until I got off to short acting NRT. But before, the patch was something that was really scary to give up. And you know what? Every time I tell to patients, when I share it with them at the hospital, the Grand River Hospital, they say that one of the things that they fear a lot is being able to break their relationship with a patch. So they've tried the patches, and one of them successful, and most of their attempts, they're unsuccessful in patch work because they had to stop the patch, and that was very scary and caused anxiety, and that was a stressor to relapse. So I think one of the biggest things talking about patches is definitely make sure to tell patients that they don't have to have the breakup after 12 weeks. They can-
Yes. Yes, for sure. And the tapering down too of using the short acting afterwards as
Yeah.
well.
I
Mhm.
still chew nicotine gum right now. I think I really like the nicotine gum. I like the short acting. It's convenient to always have it in a purse and it refreshes your breath. I also, my second favorite is the lozenges. And then the spray is still a learning curve, how to properly use it without having burning the throat.
Yeah,
How
yeah.
to spray properly on a cheek is still learning in progress, yes, but
Well, we're
Thank you,
just so
Irina.
proud of you. Really,
Thank
really proud of you. And thank you so much for sharing your story, Irina.
that means a
Really-
lot. I love sharing my story now. I feel so comfortable because I feel like it helps so many
It-
people at this point where I've been working in smoking cessation and really making a difference. It feels very empowering to be able to use an experiences and my story. And it feels like all those struggles and attempts and relapses were all worth it.
Oh, good.
Right.
Good.
Yeah.
Well, you'll be an asset wherever you end up because the credibility of your story, just, you connect with people who smoke. So you know what they're talking about. And so, yeah, I'm so happy you're in the cancer center helping patients there. So thank you.
Thanks,
Thank
Irina.
you. You're welcome. And thank you.
Got lots more to talk about when it comes to smoking
Okay.
cessation.
Okay, so now we're going to talk about brief interventions. So I want pharmacists to know, I know community pharmacists are so busy right now with vaccines. And so I want to talk about brief interventions, and the brief interventions, 3 A's: ask, advise, and act. So it's not time consuming to do this. It takes 30 seconds to 3 minutes. It's really easily implementable. And it's something that I started with when I started in smoking cessation as well, to build up my confidence. And so you just ask about tobacco status. So are they a never smoker, an ex-smoker, or a smoker? You document that. And you say the most important thing that you can do for your health is quit smoking. And I can help. We do have a smoking cessation program here. Or if you don't, you can hand them a pamphlet, say from Smokers Helpline or something like that. So it's very quick, it's very easy to do. And something that I thought about, because I almost, like Irina, I have a little bit of a business hat in thinking about this, is I would, when I'm doing COVID vaccines, I'd be asking smoking status, and I would let them know that the most important thing they can do, because COVID affects the lungs are the most vulnerable part in COVID, that if they're ever interested in quitting, I'm here to help. And as Irina said, it's not just quitting, it's reducing. Even if that's more palpable, that's easier for them to think about, than say that to them. Say, I can even help reduce to quit. That'll improve things. So, that is something that I would take that opportunity to do a brief intervention at that point, because it's a long journey. It's something that it takes smokers on average 6 to 7 quit attempts. So you're going to be with them for a long time. It's not going to be that you say, well, you should quit smoking. They quit smoking and that's the end of it. No, it's up and down. It's like a roller coaster, and every quit attempt or any reduction is a learning opportunity. They learn things. They find out what works for them. And next time that they make another attempt, they'll have that knowledge with them. So they get stronger and stronger along their journey. So now I'm going to talk about some NRT tips. So about adhesion, adherence, dosing, and coverage. So for skin irritation, I recommend that they use hydrocortisone cream 0.5% or higher on the irritated site after they take the patch off. They can, if you could recommend a non-drowsy once a day antihistamine like Reactin. You could suggest, a lot of smokers do have COPD or asthma. You can suggest that they use the Flovent inhaler or a corticosteroid topical spray applied on the skin before putting the patch on. This is a dry powder, so they still stick no problem. In fact, I have sent requests to pharmaceutical opinions to physicians to prescribe the Flovent if needed for this purpose. Apply to the patch to an area on the body which could be less sensitive, example, the top of the foot. So even though the manufacturer has only done their studies from the waist up, we know from a professional, your professional judgment that it's going to be absorbed in the skin. The skin is everywhere on the body. So I actually have construction workers who, found that the top of the foot worked for them because it was the only place that was clean and dry, had a sock over it and a boot. So that's where we ended up putting it. And it seems to be less sensitive there, but different, like the hip in some people, the back, I had another person. Of course, avoid reapplying the patch to the same skin every day. So every other day, you could do every other arm, or if your skin is really, really sensitive, then wait a full week before you would go to that area in the skin. And for adhesion issues, some people really sweat a lot or they have oily skin. Again, try the top of the foot, try a different place. There's parts of the body that sweat less and that have less oils. If you use 1 to 2 sprays of anticholinergic spray, apply that topically before the patch, such as Atrovent. And the reason for that is then they won't sweat as much in that area. And of course, you can use adhesive tape or adhesive spray. I've even had the waterproof first aid tape has worked well with some patients. And so yeah, those are a few tips for skin irritation and adhesive issues with the patch. The dosing for the patch, this is in the algorithm. So it's nice to have, just to give you a guideline, but you can see from Irina there that it's really customizable to each person. So this gives you a guide based on the amount of nicotine. So each cigarette has 1 to 2 milligrams of nicotine. So you try to base that on your NRT dosing of how much you're going to need to prevent withdrawal. But at the same time, people have different absorptions, different metabolisms. So I teach them about symptoms, and you heard Irina there. If I feel dizzy, if I feel like I have too much nicotine, then I'm going to go down. If I have cravings, I'm going to go up. So I teach them about dosing based on symptoms. And so this little chart, though, is really nice to start with, and gives you an idea of where you can suggest to start. And the other thing I just wanted to mention was CAMH has stop on the net. So if you have a patient that is, they say they can't afford NRT, there is a few things I do. I look for coupons. I have the stop on the net that they can enroll in, which they would get 8 weeks free. But I also get out my calculator and I tell pharmacists, never back away from a financial discussion, because your patient, whether they'll say, oh, with Champix, I can't afford that. Oh, NRT, I can't afford that. I have actually sat down with them. I get out a piece of paper and a calculator, and I said, well, let's just work it out together. Let's just see here. So how much do you spend a week on cigarettes? Let's see, how much a day? Pack a day. So how much is that? That's $12 a day times 7. So this is how much a week. And then you look at, well, how much is the patch for the week, or how much is Champix? And if you stop, you're going to save, as you saw from Arena there, you're going to save like thousands of dollars. So then if you can show them that in the numbers, then they'll usually say, yeah, you're right. Yeah, I know, you're right. So, but it's just you sitting down with them and going over the figures. Okay, now prescribing tips for Champix and Zyban. So a lot of people ask me, well, how do you know what to choose for a patient? And so this slide, a lot of people like because it's sort of my thought process, but a lot of it is very patient driven. So I ask patients questions and help them to come to the answer themselves. And a lot of this, also what Irina talked about, was motivational interviewing. You're really talking with the patient. You're not talking at them, you're talking with them. And so you come to the answer between the two of you. And you help guide the conversation, but they actually do make up their mind what they would like to try in the end. But it has to do with patient preference, their characteristics, dexterity, for instance, how hard is it for them to open things if they have severe arthritis, addiction level, efficacy, contraindications, previous patient experience, and cost and coverage. So these are the things that, go through my mind as I'm helping the patient, help them to decide what method that they would like to choose. And with bupropion, I just wanted to let you know that in Ontario, I get a call about this all the time. I'll say prescribe bupropion for a patient for smoking cessation, and I'll get a call from the community pharmacist who says, you can only prescribe Zyban. And that is not true. It is bupropion in the regulations. So Zyban is on the ODB formulary for only being covered for smoking cessation, but that has to do with a coverage issue, not with a prescribing issue. So for instance, I'll prescribe bupropion because it's much cheaper. So if the patient is paying cash, then I can prescribe bupropion in whatever form I think is appropriate for the patient. So I can prescribe SR, XL, whatever I feel is appropriate for that patient for smoking cessation. And when I think about bupropion, if I find when in talking to the patient that depression, there's some background of depression, this is something that I would definitely consider, because depression is a barrier. It is the reason why a lot of people smoke. There's a higher percent than normal population of people with depression that are smokers. So it is something I definitely think about for sure when I'm thinking about that component. And I monitor their mood with the PHQ-9 score, which is really easy, really fast to do. So you can I monitor that. And when someone quits smoking, it isn't the medications that can cause mood changes. It's actually the act of quitting smoking. And we know from the EAGLE study that is indeed true. So if I feel that this is carrying on too much, then it is something that, I might consider bupropion. I might consider reaching out to their family doctor if all of the things that I've tried aren't working. A lot of it, though, is that they just maybe need more nicotine. They're going through withdrawal. So these are the kinds of things you're thinking about. And that's why pharmacists should be the leaders in smoking cessation, because all of these things, are in a pharmacist's brain. And I wanted to talk about the Varenicline dosing as well, because I wanted to give you a tip there. There's lots of different ways to dose with Varenicline. So the fixed dose quit approach was the very first one that came out. And it was that the dosing should, you're going to start with 0.5 milligrams once a day for the first 3 days, then 0.5 milligrams twice a day. for the next, let's see, 11 days, and then up to 1 milligram twice a day onward. And their quit date should be within sort of that first 14 days. But the flexible quit approach is the patient begins Varenicline and then quits smoking between day 8 and 35. And the gradual quit approach is the third approach, which is they take the Varenicline and they actually start reducing the amount of cigarettes so that they're going down by 50% by 4 weeks, 75% or more by 8 weeks, and 100% by week 12. So they don't actually quit until the 12th week. But then with those patients, you should continue on Varenicline for another 12 weeks. And so there really is, and this is what customizable, that's really important, I think, with patients and what they need. And I've had patients in all three of these. I've even had a fourth patient, a fourth area, should I say, where a patient was on Varenicline 0.5 milligrams once a day for 2 years to prevent relapse. And she and her family physician and her respirologist and I all worked together to decide that that was the best approach for her, because the 0.5 milligrams once a day prevented relapse, and she had some severe lung problems. And so if you think you're going to treat someone for hypertension for the rest of their life, maybe we should be thinking differently for smoking cessation as well. So anyway, lots of customizable methods for Varenicline dosing. And for remuneration tips, I wanted to say for ODB, I wanted you to recognize that you can bill for your counseling services under ODB if you choose NRT for patients. Whatever method you choose with the patient, for the patient, you can bill for your counseling services as you go along. So a lot of pharmacists don't recognize that. And so there are cost calculators. For instance, if the patient said to you, and I mentioned this before, I can't afford NRT. Well, I've got lots of different ways to deal with that statement. And so there is the cost calculator that's available on Health Canada, where they can calculate that. There's lots of apps, those kinds of things that you really can challenge the patient in that area. And plus there's lots of tips and things you can do to help patients. So for instance, and this is something that we do in our nicotine clinics, is the 21 milligram patch is the same price as the 7 milligram patch. So for 7 patches, it's the same price. Now, so we teach patients that to cut the patches so that way they get more patches for less money if they're really strapped for that. I've had patients who use a patch every other day. That's something that, of course, wouldn't be in the product license or monograph, but that is something that some patients have found have worked for them, especially at the end of their smoking cessation journey. So those are just a few tips that I've helped with patients. Oh, and back to Green Shield, I'll tell you that, so Green Shield billing is the same as ODB for counseling, but every client or every employer is different. So please check and try a trial billing to see if it does work, because a lot of the times you could get paid for your counseling. And as far as cash service goes, I'd have to say my tip for that is promote your service. So by promoting your service, your cash service, I would go to physician luncheons. I would tell them about my service. I would teach them about their smoking cessation billing codes for the government. And I would tell them that I am going to bill as well. but it takes a village to help someone to quit smoking. And it is one of the most cost-effective preventative interventions in healthcare. So I would teach them that if they ask, advise, and act, they can bill for that. And their act is to refer to me. So I did that a lot and it worked really well. Another thing I did was I interfaced with the oncology department at the cancer center of the hospital in our area. And I told them I was doing smoking cessation. And so we set up a fax service where they would fax patients. So Irina, for instance, would talk to the patient about quitting smoking in her oncology setting, and then she could fax a referral to me in my community setting to help that patient quit smoking. So those are my tips. And
give you a time check, Jane. We're after 8 o'clock. So
okay.
let's try a case or two, and then we'll get to some questions.
Okay. All right. So I'll go to the first case.
This is the part that we like.
Yes. So this is based on a lot of my patients, actually. These aren't their real names. Blair Smith, 35-year-old male, medical history COPD. He's using Spiriva, salbutamol, and fluticasone, and his occupation is construction. He doesn't have a drug plan. He's been smoking 25 cigarettes per day. His first cigarette is 25 minutes after waking. He has had 3 quit attempts, cold turkey, not successful. He understands the health consequences of smoking. He started the gum, but it isn't working for him and he doesn't like the taste. He's not interested in Champix or Zyban. So how can you optimize NRT therapy for this patient? So why don't we just ask, what do you think, Rita, to patients, maybe if they have some ideas, and shall we say the chat or
Well, you could put something in the chat if you like, if somebody has an idea of how they'd start with this patient.
Someone says nicotine patch.
Nicotine patch.
Yeah, yes, definitely. He's not getting enough nicotine, so
First thing I would
at
check
25
is,
cigarettes per day.
yeah, I would
Yeah.
check how he used it and how much he used it the last time.
Yes, that's very good, because a lot of patients, Ruth, they do not use it properly, and so definitely check how did they use it.
I'm sure there's lots of patch stories of people that don't take the patch off and put a new one on.
Oh yeah. Oh yes, there's
Not just in smoking cessation.
Yeah, that's right. That's right. And so yeah, I would definitely explore that. I would ask him, would he be interested in trying a higher patch? Can we look at a higher strength gum? For instance, can we try a different strength gum? Can we try a lozenge? Could we try a spray? I know a lot of my people in construction, they like the inhaler because they stand around with their buddies and they want something to do with their hands. So, all of those things are options for sure. I definitely think the fact that you're going to offer help with him as well, to work with him and try different things. He's probably, maybe a lot of people just go up to the shelf, take it off the shelf, and never talk to the pharmacist. So, that would definitely be what I would do. Whoops. Now, case 2, we've got Sarah. She's 45. She has seizures. She's on Dilantin. She's unemployed. She's has ODB. She smokes 25 cigarettes a day as well. That is the majority, just so you know, 25 cigarettes per day. The first cigarette is 60 minutes after waking. 3 quit attempts, cold turkey, NRT, patch gum, not successful, ready to quit, contemplation, would like to quit, but has no confidence. And she's interested in Bupropion. So what pharmacotherapy would you recommend? Any ideas, people, in the chat? Yes, Champix. Jose, you're really right in there. I think Jose was, is it
Maybe.
Josie or Josie? I hope I'm pronouncing it correctly. But yes, definitely Champix is what I would consider for this patient, to see if she would be interested in doing that. And again, you can explore with the NRT. Did they actually use it properly, and were they at the right strength?
So this person has ODB.
In case 3, we've got, yeah.
Sorry, this person has ODB coverage. Does
Yes.
that mean that you can do all the counseling with her and be covered for all your counseling?
Yes.
She must have like Trillium. Okay, good.
Yes, Trillium and ODB. You can
Okay.
bill for, like those, you can bill for your counseling.
So there's a
Yes.
great opportunity there because there's lots of.
Oh, definitely. And if they know that you're going to work alongside them, that increases their confidence.
Mhm.
Oh, yeah. Okay. And this is a 50-year-old, and he's on Trillium, and he's 25 cigarettes a day, and he started Bupropion, but it's making him nauseous and causing vivid dreams, and he wants to stop it. So how do you help Shane manage his side effects? Does anybody know how? Because what I find is a lot of patients, and this is in the first 3 calls I find, is you're managing their side effects with their medications. You're managing how can you help them so that they just don't stop it and say, oh, that didn't work. You know, that caused that. Does anybody have any ideas of how they could manage this fellow who's nauseous with his Bupropion and he's got vivid dreams? No one yet.
I'm a pharmacist, so I can't even ask questions.
Decrease
the dose.
But yay, Colleen, yes, that's right. That's what I would think about, is I would think about the dose of Bupropion, because it's 150 milligrams SR twice a day is the normal dose, but I found a lot of times the 150 milligrams once a day is plenty. And when you're combining it with something else as well, if you're combining it with Champix, if you're combining it with NRT, a lower dose is definitely helpful. So consider the dose. Make sure they're taking it with food, because so often I'll say, oh, take it with food to prevent stomach upset. Well, it just goes, you tell them so much in an appointment that they forget that. And the first call I'll make is, yeah, I was on my drive to work and I pulled over and I vomited into the ditch. And, I'm not happy about that. And I'll say, well, did you take it with food? No, I don't eat breakfast. So I said, well, I would really like you to consider just trying, could you have a piece of toast? Could you have a little something? Because that's going to reduce that side effect of nauseousness. And the vivid dreams are something that I tell people won't kill them, but smoking will. And so dreams are usually, I teach them that the dreams are their body, what they went through during the day. So they're usually, it's fear. Can I quit smoking? So it might be a dream about fear. Or the second part is loss. So it's like the loss of a friend. Your cigarette was beside you for many years, beside you every day. And now, your brain is processing the loss of a friend. So that's why some people dream about loss or fear. And fear might be clowns coming out of the closet, because that's what you are fearful of, is a clown, but it's actually your brain processing. Can you quit? I'm fearful. Can I do this? So once I tell them about that, it really alleviates their concerns. And a lot of them stop having those vivid dreams. So that's a tip there that I use.
Okay.
All right.
Time check 8:09.
Okay, do you want more cases or do you want to look at questions?
We have one question here. Well, thank you to Leslie Phillips, who made a comment towards Cheryl, was asking about the vape pods. So
Oh, yes,
yeah.
yes.
So the vape pods for JUUI or views are mostly sold in 1.6% or 16 milligram per mil and 2% 20 milligram per mil strengths. The pod sizes are 0.7 to 1.9 mils, depending on brand. The 30 mil bottles of e-liquid are usually sold in 3, 6, 12, and 18 milligrams per mil, not per 30 mils. I find vapors often don't know how much nicotine they are getting and are often shocked to find out.
Mm-hmm. So
So,
true.
yeah.
So true. Yes.
And then
Thank you,
someone,
Leslie. Thank you. That's
and
awesome.
somebody, maybe Bhavin, are there any Health Canada approved nicotine vaping devices?
Well, approved, yes. I mean, they are allowed to be sold, but yes, so in Canada, vaping devices are allowed to be sold, but not, they haven't, nowhere does it, can they be approved for cessation. In the UK, they're used in their national smoking cessation programs. So in the UK, if you went into a pharmacy, the vapes are sold alongside the NRT. And if you went into public health to get help with quitting smoking, they would offer you NRT, a vape, or Champix or Zyban, but not in Canada. Okay.
So a comment about people usually smoke, say, a pack a day, so 25 cigarettes per day. Any push for the government to look at harm reduction strategies, like reduce the number of cigarettes in a pack, make each cigarette shorter?
Yes, they're looking at that for sure. I noticed, and this is something that one of my colleagues suggested to the Canadian government, and I see New Zealand has adopted it. They're actually going to prevent anyone from the age of 14 from buying cigarettes for the rest of their life. So it will be like, it'll go up till eventually their whole population will then never be allowed to buy cigarettes. So they will be able to take them off the market per se. There has been talk about a lower percent nicotine in a cigarette. My fear with that is that people will just smoke more because they're wanting the nicotine. They need the nicotine. So the combustion, the part that causes the harm, it's not the nicotine that causes the harm, it's
Exactly.
the smoke. So now they're going to smoke 50 cigarettes instead of 25. I'm concerned about that idea. I don't think I could support that idea.
Can patients use Champix, Zyban, and NRT all at the same time? I think I know the answer.
Yes,
I've heard you speak
do,
before.
Ruth.
No.
Ruth, pardon me?
I can't answer this.
Yes, yes. Okay, yes, yes. I have used it several times in patients, people that were highly addicted, that we have tried everything, and I can see the patients' faces. That's what worked for them, all three at the same time. There's studies on combining Champix and Zyban, combining Champix and NRT, providing Zyban and NRT. There haven't been a lot of studies on all three at the same time, but in theory, I guess it could help, and I certainly in my practice it has helped in some patients. Any other questions, Ruth?
No, we're out of questions. Let's just go back to one more case study though.
Case study?
Yeah, let's go to
Okay.
case 5, John.
Okay, so he's 55 years old. He's uses a wheelchair. He's got arthritis. He has neuropathy. He has hypertension. He has ODB coverage. He smokes 35 cigarettes a day. His first cigarette is within 5 minutes of waking. He's tried NRT high doses through the STOP study. STOP study doesn't prevent us from giving any sort of quantity, and they're allowed 26 weeks annually per year. Champix, Zyban, and combinations of all three. He's tried hypnotherapy, acupuncture, and he's had no success. And this was actually a patient of mine, and I can see him sitting in his wheelchair in front of me. He had severe health problems. Has anybody got any ideas on how they would help John reduce his harm? Vaping would be the only solution. And for him, it was. And so he actually came to me and he said, I've tried everything and you've really helped me. And we've really tried hard and we've really worked hard for a number of years. But I'm really thinking about vaping. What do you think? And so I said, well, for harm reduction, it's not harmless, but it's less harmful than smoking 35 cigarettes per day. He actually started at 60 cigarettes a day. So we got him down to 35. So yes, for tobacco harm reduction. And for him, because he had arthritis, the pods were the easiest for him. And that is what helped reduce his harm. So there are times when it is the only solution left, and it's definitely something that I would consider if there was nothing else on the table. So yeah, and so I want everyone to know that Pharmacists for a Smoke-Free Canada, Ruth has it up right now, the website, that you're welcome to join. And it's a free membership. You just go to the membership and sign up, and we send out emails regarding events such as these or other information that's coming down the pipes. And please reach out to us as well. There's an email address if you have any questions. We're happy to answer. We have amazing VPs, Leslie being one of them from Newfoundland. And so I was glad that she was with us tonight. Thanks for your support, Leslie. And OPA, I mean, the Ontario Pharmacists Association has been so supportive. And we've worked together well with developing the algorithms and supports for pharmacists. And anyone across Canada can take the course. So there's many different modules, and they've got lots of other exciting modules to take about paid consultations. So getting paid for your cash services. And Ruth, did you?
Well, I just wanted to say that, I put these other two in here because we recognize that pharmacists getting paid for filling prescriptions and just filling prescriptions is just, it's not a sustainable model, and we're going to see change in the future. And I know it's coming. So whatever you can do to build your bench strength in providing these services, personalized services to patients. I know that our healthcare system is straining and people are turning to you for your help, and you're there for them. And let's learn about some of the things and how to do these consultations. And then again, so thanks, Jane. It was amazing. You know so much. I mean, we could talk forever. There's so many different things. I'm sure, and a lot of the stuff that she's talked about and the tools are on the website, both the OPA website and the Pharmacists for Smoke-Free Canada website. And so lots of things there. Also, we're recording this and that'll be shared. And so before I leave, I want to again thank Johnson & Johnson Consumer Health. I really like their app thing. I'm really excited about this app and the fact that I don't understand this tap technology, but you can use the app without the tap technology. It's just a little bit more manual to put stuff in, but take a look at that. Look what's on your shelves. If you're working for a chain and you don't make those decisions, at least you can go look at it on the shelf. And Thank you, everybody, for coming. It's a busy time of year, and thank you again, Jane. It was great. And thanks, Irina, too, for coming. Our special guest. Have a great night, everybody.
Thanks,
Bye.
Ruth. I appreciate it. Thank you for the opportunity.
You're welcome.